Since the NRC's purview is radiological health and safety, how does the Vermont Health Department interface with that role?
Yeah, we have the benefit of having our own radiological health regulations with regard to this plant, different from every other state in the country. And the NRC has not only allowed us to continue to apply that without arguing that it's outside of our rights, but they respect what we're doing. In particular, they're very pleased to see the level of sampling that we've done over the course of years, and also the specific increased level of sampling that's been undertaken since this was reported to us. And they also have great faith in our laboratory capabilities and the people that we have working on this. I think to some degree the fact that they don't do independent assessments on their own and generally would rely on the work of their licensee, Entergy Vermont Yankee, they are pleased to have an independent assessment being conducted simultaneously to give them another source of data to evaluate as to what's really going on there, as well as the validity of their licensee's actions and reports.
Is this costing the state of Vermont anything, or is Entergy being billed for all the work?
I've been told that Entergy has informed the administration that they will pay for the state's costs for this investigation. All the agencies involved in this are putting together their budgets for this. Currently we have about 40 people working on this out of our Health Operations Center in Burlington, and it's unlikely to cost as much as some of the consultants that we have there, but it's certainly going to be a lot of work that's going to all be compensated.
So we're in the wrong business. Kurt.
Hearing testimony from different individuals, reading everything that's been reported in the paper, can you just state whether, because I think there's a fine line between what some people testify and what you're testifying. I don't see enormous difference myself, but some. But can you state whether there's anything that you read or heard said publicly in public statements that you think is absolutely wrong?
I haven't heard anything that is incorrect. There's certainly language that I wouldn't use. The characterization of 775,000 picocuries per liter is good news. Is one.
Yeah, I got that right here. It's been.
Is there, would you characterize right now you have a great concern. Is there a point to which, at what point would great concern turn to something close to alarm?
Well, the identification of well that's used by residents of Vernon or Hinsdale or elsewhere of radioactive material from that plant would be alarming for us. Not because of the significant health risks associated with it, but the efforts that are always made in public health with regard to radiation protection are that you don't want the public to be exposed to something that should be absolutely prevented. And despite the fact that there are loud levels of release into the air and into the water, this is not from one of those pathways that's engineered for that. This is a pathway that is totally not designed to be a pathway to the public. And for that reason, it's not appropriate that we find it here.
You also mentioned a few minutes ago that it's possible that the leak has been occurring for a long period of time.
It is possible. Tritium has a half-life of 12 years, a little bit more than 12 years. So it could have been 1.4 million 12 years ago, and it could have been another twice that 36 years ago. So it's really important to get a sense of the source quickly to understand.
When we get all the knowledge that leaks found, et cetera, will we be able to ascertain how long the leak has been occurring within some degree?
It is possible that the identification of an actual leak would allow for some identification of how long this has been going on. It is possible that this only began a couple of months ago when the very first tritium was found in monitoring well in November of 2009. But it could also be that where this well exists, it was a very small rivulet of water that made its way there, and that there was a larger pool of this, or a larger flow path of this that was not in the path of a well. And now that wells have been put there, we are in that path. So we'll just have to get a better sense of the hydrogeology there, and then find the source or sources, and have a better idea of that.
Did I hear you correctly earlier say that there's also a possibility that we won't find the source of the leak? That there's a possibility that you couldn't find the source?
Yeah, I'd have to say that there is that possibility, as I mentioned in that particular example. If this is something that occurred in the past and has been since solved, repaired, has a system that's been shut down, no longer used, and there are some components there that were used in the past that were cut and capped, that was the source, and that this water has been there for that time. And as such, all of the investigation for all of the active systems, if they are exhausting and not finding a source, that would be a possibility.
I wanted to ask you earlier, when you talked about the possibility of pressurizing the pipes to find a leak in the system. I once pressurized the pipes in my system in my house, and I created more leaks than the original leak. Is that a possibility?
And I believe that's actually being done in those systems that are not actively used but are intermittently used. They can isolate the system, put pressure on it, and see if there's leakage that's occurring. And I'm sure you would recognize that there's a lot of differences between the plumbing in your house and
Especially this.
Yeah.
Sarah, and then Margaret.
I'm trying to recall if there was a previous leak. In 1997, was there one?
76.
Was it 76?
Yep.
Do you know anything about that? If not, I'll ask Mr. Vanags, but
Right.
do you
No,
know that?
I do know that in 1976 there was an overflow of the condensate
Right.
storage tank.
Okay, that's what it was.
And I think it was about 84,000 gallons of heavily tritiated water.
Okay.
And there is a report in the Department of Health files on this, and there was also a report generated for the Nuclear Regulatory Commission about that. And the report stated at that time that it was believed that all of the water ran off of the human-made surfaces there into the river, that it was unlikely that the water passed through the pavement into the groundwater. But I don't want to at all
I'll ask Will just about
try to figure whether that was accurate